Resuming debate, the Honourable Member for Vancouver East.
Thank you very much, Mr. Speaker, and I'm pleased to rise in the House today to speak on Bill C-300 and would again like to congratulate the member for bringing this bill forward. It came from committee and it's now back at third reading in the House. And Mr. Speaker, as I alluded to in my question and comment just earlier, certainly the NDP members on the Health Committee, we've been very supportive of this bill, as we have in the House at second reading, and we will support this bill when it comes to a final vote. I do want to, though, however, illuminate a little bit on the bill itself and I guess reflect on the nature of this bill and what possibly we could have done. I know that there's also another bill in the House, Bill C-297, that's been put forward by my colleague, the member for Halifax. And the two bills, although they're both dealing with suicide prevention, basically bring forward a strategy in a different way. I think this particular bill, C-300, is much more of a limiting bill. It seems to us that it does plays down the role of the federal government in establishing suicide prevention strategy. And unfortunately, as I pointed out, there's nothing in the bill that particularly pertains to First Nations consultation. Now, I recognize it's difficult to put every single group in a bill and say you should do this and this and this, but I think the statistics show, and I'm going to read this into the record a little bit later, this is a very important health issue and systemic issue around inequality and cultural history and colonialism that does affect First Nations in Canada, Aboriginal people. So it is very striking to us that the member from Halifax, in her bill, she speaks to the need to directly engage the federal government with provincial ministers, First Nations, and support smaller communities and provinces that might not otherwise have the infrastructure to enact a strategy. So she lays out a clear federal role. And again, in that bill, C-297, it explicitly outlines the need that First Nations, Inuit and Métis groups would be involved in the construction of the strategy. To me, Mr. Speaker, this is something that's very important. The current bill that we're debating today really calls for defining best practices and promotes collaboration. Now, these are very important things to do, and we certainly concur with that, but it's very disappointing that it actually doesn't go beyond that. C-297 is very comprehensive in that it calls for the federal government to carry out 10 different projects, including a study of effective funding, surveillance to identify at-risk groups, establishing national standards, and gaining cultural-based knowledge in preventing suicide, amongst other things. Now, Mr. Speaker, I do want to point out that at committee, myself and my colleagues put forward a number of amendments, and particularly the member for Chicoutimi-Lafayette put forward a number of amendments, some of which were based on the Canadian Association for Suicide Prevention blueprint for a Canadian National Suicide Prevention Strategy that came out in September of 2009. Now, this is an organization that's really represents the service providers and the activists who are on the front line helping people who are in distress, who are at risk in dealing with suicide and suicide prevention. And we put forward a committee, Mr. Speaker, I think about 15 or so amendments, and they really would have strengthened the bill. For example, one of them called for a distinct national coordinating body for suicide prevention to operate within the appropriate entities in the Government of Canada. Another amendment called for assessing and adopting, where appropriate, the recommendations and objectives outlined in the blueprint for a national suicide prevention strategy of the Canadian Association for Suicide Prevention, the organization that I just mentioned. And so, Mr. Speaker, I do want to put on the record here in the House that we tried very, very hard at committee to actually bring some amendments to this bill to strengthen it so it could go beyond an issue of best practices and collaboration and information sharing and take on some more specific objectives that we think are desperately needed. Now, we did hear a number of times that we shouldn't worry about this because the Mental Health Commission of Canada would be addressing this in their report. Well, of course, since we did deal with the bill at committee, that report has now come out, Changing Directions, Changing Lives. It just came out last week. And indeed, there is some specific reference to suicide prevention in the mental health strategy for Canada. And one thing I would point out on page 17 is that they say establishing whole-of-government and pan-Canadian mechanisms to oversee mental health-related policies, strengthening data, research, knowledge exchange, standards and human resources related to mental health, mental illness and suicide prevention. Now, that's not the only one, but to me that one speaks very strongly to the need for all governments, every level, including the federal government, to be involved. So while we're happy that the Mental Health Commission of Canada has included this issue in their new strategy that came out last week, it seems to me that we missed an opportunity with this particular bill to actually look at some real concrete specifics around setting up a national coordinating body, looking at better training, or more specifically working with First Nations. Now, Mr. Speaker, we did actually receive a communication from the Assembly of First Nations after we dealt with the bill at committee, and they sent some very good information that I think is very important for us to understand, and it's really shocking. It's information that we know, but when we speak about this issue, it brings to mind how serious it is in the Aboriginal community. And the AFN points out that suicide now represents the greatest single cause of injury deaths in this population. That was a study done in 2003. And then they point out a closer examination of intentional self-harm or suicide across age groupings shows that the deaths due to suicide as a proportion of all deaths was the largest amongst First Nations youth. They also point out youth suicide is not a tragedy that is visited in equal measure in all Native communities. In certain communities, the suicide rate is as much as 800 times their provincial average. I mean, Mr. Speaker, these statistics, they can't even begin to tell us the stories and the tragedy and the reality of what is happening in many smaller, remote communities, also in urban centres. And so I do feel that it's with disappointment and concern that this bill did not reference the particular issues that are taking place in Aboriginal communities. And as I say, there were amendments put forward where we endeavoured to include some of this important information and the need to be more specific in the bill. And surprisingly, all of those amendments were turned down. And it does worry me that this is becoming a pattern now, that whatever government bills are put forward, these sort of small, the bills are some of them are fine in as far as they go, but they're very informational. They're very, let's create awareness. We had one just the other day on breast density, a similar kind of bill. So I don't want to, knock the bills in and of themselves, but it is really worrying that when there's a genuine effort to put forward amendments to improve and strengthen these bills, they seem to be automatically shut down. And I just kind of want to put that out there and ask the question why. To me, this is not, Parliament should be constructive as parliamentarians, particularly on private members' business. We should be figuring out how we're constructive and working together. And this bill on suicide prevention, because we all agree with the need for work to be done on this. I mean, there's no question about that. We all agree. And so it is very concerning that the good faith attempts to strengthen the bill and improve the bill were just shut down 100%. And as I've read out in some of the information that came before us, this was basically ignored. So we will support this bill, but I do want to make it clear that we will also work very hard to support the bill of my colleague, the member from Halifax, Bill C-297, because it is a much broader, comprehensive and very specific strategy that will clearly involve the federal government. And that's what we need to do, Mr. Speaker, particularly in light of the new report that just came out from the Mental Health Commission of Canada. Thank you.
Resuming debate, the